I think that it's an interesting study that does show that we are diagnosing depression more frequently over the last couple of years, which I think is a good thing because people are getting the treatment that they need. There have been a number of national programs over the past 10 years that have stressed the importance of recognizing depression. And it is not unusual when you go in to see your primary care physician now that depression screening is now part of the initial screen that you get when you come in. Even a 2 or 3 question depression screen is validated to recognize and pick up depression or depressive symptoms so that a more full and thorough evaluation can be done. There are so many reasons for depression, whether that could be stress-related, loss of a job or a loved one. It can be situational because of chronic conditions, someone with cancer. I think the National Institute of Mental Health estimated that 25% or a quarter of patients with cancer have depression. A third of the patients who are cardiac heart attack survivors have depression. Those are major life-changing events. Your life just gets turned upside down, and I think people are recognizing that, okay, I'm not feeling the same way. I've lost interest in doing things. I'm tired. But if I go to my doctor and I ask about that, I can be helped. There are things that can help me. You know, I don't think it's necessarily a side effect as much as it is just a life-changing event. 85% of the people with depression have at least 1 to 2 chronic conditions. And I think the more chronic conditions you have, the more likely you are to have depressive feelings. Because it changes your lifestyle. It may disrupt your sleep. If you have rheumatoid arthritis, you're not exercising like you used to, you hurt a lot, you're not feeling well. And that change in the lifestyle, you have to grieve for that loss of that lifestyle. So it's really an important loss. Then you add a couple of conditions onto that, and I think that it's very common for depression to be a picture, to help color that picture. So very important if you're not feeling well to reach out to your physician. Oftentimes we see when we look at our costs and our trends that if there is a depression diagnosis, that the costs are about double for the condition without the depression diagnosis. Part of that could be medication related, which is fine because some of the newer antidepressant medications can be a little bit expensive, and so we know that. Also, those patients have chronic conditions which add to the medical spend for that patient that has that depression diagnosis. So I don't know that it's really an alarming statistic or something that we're not expecting, but what can we do about that? I think it's really making sure that we're reaching out through the offices and through case management to make sure that those patients are adhering to their medication, that they're exercising, they're eating properly, they're sleeping properly, so that we can make sure that those expenses are minimized. We would like them to see their doctor instead of going to the emergency room. We want them to have a care plan in place so that they know what's expected and what the next course in treatment is for their chronic disease. So really just making sure that that patient has a support system in place.